we're learning about medicine and medical ethics. Medical halacha or medical ethics is a very strong interest of mine. When I was in medical school, so we had to write a medical school thesis. So yeah, 40% of our class went to become do MD PhDs, and every single student at Yale Medical School had to do a thesis. And actually, during a big part of my training, I was thinking of doing a thesis on medical Jewish law, like medical ethics, specifically on the right to die or the right to terminate life when a patient's suffering, or the withdrawal of treatment. I ended up doing my thesis on an ophthalmology project because I was interested in ophthalmology, and that would be a little bit more powerful. And just as a side note, anybody who's interested in going to a specific field of medicine, while you're in medical training or medical school, the more you develop areas to express that interest and do research in it, the stronger your application is. But anyway, today I was asked to discuss we could talk about different subtopics, but we'll start with a topic that's interesting, that has some interesting recent history in American law and medical ethics, as well as long-term parameters. Many of you probably heard about Siamese twins. Well, Siamese twins, or conjoined twins, are twins that, when they're developing in utero, so the cell splits, and normally twins that split, they split and develop independently. But if they don't completely split, they grow and develop together, and they actually are born as one connected unit. If it's just a simple thing where they're joined at the shoulder or at the hip, they can be separated surgically. But more often than not, they're joined in such a way that they share organs. They can share a gastrointestinal system. They can even share a heart. They can share major body parts where it's not so simple to separate them. And their stories, and the reason they're called Siamese twins is because the original story was, I think, in the 1800s, where there were a pair of male twins in Siam that later, I think now it's Thailand, but anyway, they were born that way, and they lived that way, and they never were separated, and they actually married sisters, and they fathered and all together they fathered over 20 children. And it was a well-known story, and from that time on they were called Siamese twins, but that term has gone out of favor. It's typically called conjoined twins. And the question is, what do you do when you have conjoined twins and it's not so easy to separate them? Let's say you want to separate them, but there's a high risk. What kind of risk can you take to this pair of twins that the surgery may kill them, but let's say they don't want to be together, they want to have an independent life. Think about it yourself. As much as you like your brother or your sister, I don't know if you want to be joined at the hip forever, or joined at the chest, or have to kind of walk in a cumbersome way because you only have one set of legs between both of you. I mean, you can YouTube this, and there are a couple of interesting little vignettes or stories about conjoined twins and how they live as teenagers, how they get along, how they go around, how people look at them as freaks. It's very interesting. I actually was looking at it the other day because of this talk, and they really occur in 1 in 50 to 60,000 births. Most of them die early on, but some of them survive and live, and how they live is a challenge. And obviously, if one can separate them surgically without tremendous risk, commonly that's something that's done. Let's say you can't separate them with any minimal risk. The risk to separate them is severe, and the risk of their death is higher. I don't know how we can do this as a group and get some interactive feedback. But if I ask you, I guess you could unmute yourself if you have something to say. Let's say I told you that the surgery to separate them would have a 90% mortality. And they say, but we can't live like this. We hate being like this. I'd rather die than have a life like this. They're each willing to take a 10% chance of life and a 90% chance of death by being separated. Are you allowed, as a surgeon, in Jewish law to go ahead and do that? It's consensual. They want it. They're willing to take that risk. They can live this way as much as it's uncomfortable. It's their choice. It's their life. Are you allowed as a surgeon to go ahead and do the surgery? Often these surgeries need a team of 10, 15 people and multiple specialties to kind of do their part of the body and reconstruct whatever is severed. Often 15, 20-hour surgeries, major operations. Unfortunately, some of these famous surgeries have ended in the babies or the children dying. They say they're willing. Anybody? Can you do that? What kind of risk can you take to do that kind of surgery?
Well, what's the risk to not doing the surgery? Because I think, if you have to compare. So, is the risk of not doing the surgery high as well, or is that kind of a minimal risk?
So that's a good question. Obviously, if there's a high likelihood of them dying, it's a high percentage that they're going to die, or definite or close to definite they cannot survive more than a year like they are, then Jewish law dictates that you're allowed to take on a risky procedure. And this is relevant to someone at the end of life. Let's say somebody's at the end of life and they have cancer, and the doctors predict that without surgery, they're probably going to die within a year. And the question is, why did I come up with a year? Why not 6 months? Why not 3 years? And different rabbinic authorities, most notably Rav Moshe Feinstein, who was the preeminent rabbi and ruler in Jewish law in the last generation. He really led many issues, and we'll get to a story of Siamese twins he was very involved with. But he helped define these parameters and understand them. Rav Moshe Feinstein lived in New York. He was originally born in Europe. He came to America, early on after Second World War. Actually, I'm not sure what year he came. Maybe he even came before the war. I think he came after. And he basically led the Jewish people, both here and in Israel, in terms of Jewish law in many areas, especially in medical halacha, areas that relate to medicine. Actually, there's an interesting story with him. In the early days of heart transplantation, Rav Moshe was being consulted on how and whether it's permissible to perform a heart transplant, because most of the patients died at the beginning years of heart transplantation. I actually have my wife's uncle is now 30 years. He just celebrated his 50th and 80th birthday. Sorry, his 30th and 80th birthday, because at age 50, 30 years ago, right before we got married, it's a while ago, he had a heart transplant. And now he's still living and doing okay with a heart transplant 30 years later. Well, in those days, that was unheard of. People lived months, maybe years, not even. And most of them died. And so there was a religious doctor involved in the cardiac transplant team in New York who went to visit Rav Moshe Feinstein to talk to him about his thoughts about whether this is a permissible thing to do, given the fact that you have a patient and that they're sick, but they're not dying right away, but they have a risk of dying with heart failure. And can we go ahead and do a heart transplant in order to try and save their life, maybe give them longer term survival, but maybe not? And the doctor came to Rav Moshe Feinstein in the yeshiva, and Rav Moshe told him, it's loud, it's busy here. Let's go to my house, to my apartment, and we'll talk. It'll be easier. So they walked down the street from his yeshiva to where he lived in the Lower East Side in his apartment, and he walked into the building, and there was a little child playing in the building unattended, like a 3-year-old or something. And Rav Moshe turns to the doctor and says, "We can't go upstairs yet." She says, "Why not?" She says, "Because this child, no one's watching the child, and they're not old enough to be safe." So the doctor turns to Rav Moshe and says, "Well, just call the parents." She said, "Well, you see, this child lost. She's a widow. The mother of the child's a widow, and she's by herself. And there's no father to call. So he says, so call the mother. She says, no, I don't want to call the mother. We'll wait here till someone shows up and takes care of the child. And he explained that he didn't want to call the mother and tell her child's down here unattended, because he didn't want to make her feel badly that he may be implying that she's not on top of her game or attentive in caring for her child. He was so sensitive to the mother's feelings, he didn't want her to feel like she's negligent in her duties as a mother. So he decided he'll wait and watch the child. Here he has the whole world waiting on his shoulders, and the doctor coming in to talk to him, but the child and the mother's feelings were of paramount importance to him. He was an amazing person. So, and in cardiac transplantations, in the beginning years, he ruled that it was prohibited, because most of these patients, you do the surgery and they die early. And right now, there's a good chance that they may survive more than a year. And one of the things he determined and explained is that when someone has more than a year survival, that's called chaye olam. We all have a limited time on this earth. Some of us may live 100 years, some of us may live 10 years, but that's life. Life it's unknown how long it'll be. But the Talmud teaches us that with animals, it's also that way. But an animal that will live less than a year is considered a treifa. And similarly, a human being that will live less than a year is also considered a treifa. And if, God forbid, someone murders another human being, another Jewish person, he's culpable in Jewish courts as a murderer, and he can be, he can receive a capital crime for murder if he does intentionally and is forewarned and with the right witnesses, etc. However, if someone kills a treifa, someone who is quote unquote medically ill and he will die within a year, then he doesn't have the same level of culpability, because he's in essence a dying person, and a dying person doesn't have the same cheskas chaim, doesn't have the same established credibility of life as someone who is more projected to live more than a year. So there's a term called chaye shah, short-term life, and long-term life. And that short-term life doesn't have the same power of stability as long-term life. And we have that regarding an animal that won't live at least a year is not kosher, because it's not full-fledged life. Similarly, if somebody has a full-fledged life, he has projection to live more than a year, then that person cannot go ahead and take risks to his life that have a high risk of death. However, if someone has chaye shah, he can't kill himself if he's unhappy. That you can never do, even if it's chaye shah, even if it's short-term life. However, a person is able, if he wants to, because of his short-term life, to go ahead and take on high-level risk, even if it means there's a chance they will die. So, typically, it cannot be that it's most likely that he'll die. I think Ramesh uses terms like, 2/3, 60, 70% that he has a chance to survive with the surgery, even if he has a surgery, he can die immediately. And right now he may live 6 months. He's still allowed to take on that risk of dying, even though it's as high as 30%, in order to go ahead and have surgery or have a procedure that may give him a longer term life. If it's almost definite that he's going to die, and it's this remote chance, 10% or less, then we do not allow him, even in that setting, to take on such a risk. If he has long-term life, then to take on a procedure that will give him better longevity, it has to be significantly low risk. It has to be significantly less than 50% chance that such a person may die from the procedure. And similarly, in our case, if this conjoined twin group is likely to live the way they are without major compromise, even though it's very unpleasant, then they would not be allowed to take on significant risk. The question is, would they be allowed to take on any risk? They'd probably be allowed to take on some level of risk in the 20 to 30% range of even dying, because they're suffering so much. It would be complicated. There would be a question, what kind of risk? It'd have to be lower risk. Some authorities would say it has to be a less than 10% chance of mortality from the surgery. in order to do this procedure if they could live the way they are. And most of the time it would have to be really low risk. And in medicine, we don't like to take on significant mortality risk unless someone is at threat of death. So if somebody has, cancer that will kill them, we realize that sometimes we'll take on higher risk. But if they have a potential to live, even though it's not pleasant life, then we typically, even in medicine and definitely in Jewish law, do not accept high-level risk. It has to be significantly lower, generally less than a 10% risk of death, to go ahead and do that. So that would apply to any kind of case, including this case. There's an interesting story that occurred during Ramosha's life. At the time, the previous Surgeon General, C. Everett Koop, was the pediatric surgeon in Pittsburgh, where they did a lot of transplants and a lot of surgeries. And I don't know if you ever heard of C. Everett Koop, he was the Surgeon General who led the fight against smoking, and he was the one who introduced all these warning signs on smoking, on cigarettes, telling people that this can cause cancer and death and all kinds of things. And a lot of the warnings and the whole program that led to a reduction in smoking in America was much thanks to C. Everett Koop. Well, at the time, before he was Surgeon General, he was a pediatric surgeon in Pittsburgh, which is still a famous surgical hospital with a lot of advanced and new techniques. And when Dr. Koop there was a couple, actually it was a couple from Lakewood, that had a child that was a conjoined twin. And they were connected at the chest, and they shared one very unusual 5-chambered heart. And the cardiologists were studying this, and they found it fascinating, but they had only one heart. So you can't separate twins with one heart without one of them dying. One of them has to get the heart. The other one can't get the heart. And it's not like you can just go fetch another heart. You can't just create a whole cardiovascular system. And the question was, are they allowed to go ahead and separate these twins when one of them will for sure die? We generally have 2 heads, 2 brains, 2 personalities. And the feeling, these were really babies at the time, but the feeling is, in general, these are 2 people. And the fact that they share a single heart doesn't make them one person. If it was just, let's say, an appendage, a person had a 3rd arm, so you can cut off that 3rd arm or if they have 6 fingers, you can surgically remove that so they can have a more normal function. But to cut off the head, the brain, the whole setup, the whole side of the person, which is another person, in order to allow survival, we'll call them twin A and twin B. If twin A, would be given the heart and twin B would die, are you allowed to do that? And what would be the justification to doing that? So like somebody mentioned, who asked the question about the survival? Whatever your name is. So.
Oh, sorry. Yeah, that was me.
Okay, that was a good question. So if both twins can survive and be and function with the shared heart, then there would be very little justification to go ahead and kill one of them to save the other. That would not be acceptable. However, because it's like if 2 people, right? I'll give you an example. There's a Talmudic discussion. Let's say 2 people are in the desert and they only have a certain amount of water and they can barely make it with some undue suffering, but they'll survive. They'll be thirsty, they'll be hungry, they'll be exhausted, but they'll make it to civilization with the food that they have by sharing it. Let's say one of them has the food. Person A has the food, person B has no food. Is he required to share his food with person B in order to get to civilization so both of them can get there with some level of suffering? Or since it's his food, he can keep it. He doesn't have to share it. It's very unpleasant, very uncomfortable. Is he required to share it with person B in order to get the civilization and suffer? The answer is yes. He must share it. He has an obligation to expend effort and even some discomfort and even some money, a significant amount of money. Some say up to 1/5 of his assets. Some say all of his his accessible assets. If he has $1 million in the bank, he has to spend up to $1 million to make sure his friend makes it to civilization and survives. Let's say they only have enough water to make it civilization for one of them. The Talmud has a discussion. Do they share it and live a little bit longer, even though they both die? Or do the person who has the water, person A has the water, and person B has no water, and person B says, Mr. A, please give me some of your water so I can at least live another day. And they have, 3 days to get to civilization. And person A knows that if he keeps his water to himself, he'll make it to civilization 3 days through the desert. The person B will die. He is not, there's a discussion. Ben Petura says they should both share it, and one should not see and witness and cause the death of his friend. Interesting position. That means they both die. Rabbi Akiva, the famous Rabbi Akiva, says no. The one who has it, sorry about that. Rabbi Akiva says your life comes first, and you do not have to share it. You can partake of the water, even though the other person will die. To explain this unusual position of Ben Petura, many explain what he means is that if you keep the water for person A, he'll make it to civilization that is a known civilization. But there may be a caravan that comes along the way. There may be other ways that will save them along the way. Because of the possibility of them both being saved by sharing the water, Ben Petura says, no, you have to share it. Even though you don't know that there's a caravan that will come, you don't know that there's civilization, but since there might be, you are required to share it with one another. Rabbi Akiva, and this is how we rules that no, you don't have to do that and risk your life because of a maybe that you'll be saved. If you know that you can save your life and you have the water and it's your water, there's a concept in Jewish law called chayecha koidmin. Your life comes first, and you're allowed and maybe even required to save your life, even though by the inaction of sharing it, you'll be saving your life, you'll also be allowing the other person to unfortunately die. So in our case, there's some suffering associated with sharing it. In the first version, where there's enough for them to share it, they're required to share it. Similarly, if this conjoined twin can share their hearts, live through life, be limited in their function, and you see some interesting YouTubes about these kids that they learn to grow up. And look, the classic namesake case of the Siamese twins from Siam that lived and grew and raised families, they actually managed to figure out a way to raise a family and even get married. So it is possible, even though it's a little awkward and strange type of living, not what we'd imagine for ourselves. But there's no permissibility to end one of their lives in order to save the other if they both can survive that way. But the case that happened in Lakewood, where they went to Pittsburgh to consult with the surgeons, was that there was no way to save them both. And the cardiologist felt that if they try to raise this twin set without surgery, they will both die. The 5-chamber heart cannot support the life of both of them. It's just not strong enough. And it'll poop out and not make it. So they didn't know when, but they felt the babies wouldn't survive. So the question is, how do you determine, are you allowed to actively kill one in order to allow the other to survive? And how do you decide? And Ramosha, it was an interesting thing. The family was from Lakewood, and they wanted to consult their the great rabbi, who's one of the authority in Jewish law. And they had a big conference room set up in Pittsburgh with all the surgeons, all the opinions, and everybody saying, this is what we should do, this is what we should do. And Dr. Koop, stopped the meeting and said, we're not making any decision till their rabbi from New York gets here and tells us what to do. And it was a big Kiddush Hashem. It was a big sanctification of God's name, because he recognized, both because they were a religious Jewish couple and because they were sensitive to the wisdom of this rabbi. I heard the story from Ramosha's son-in-law. They helicoptered Ramosha from New York to the meeting to hear all the back and forth parameters of this discussion. And he heard the story, and he made the decision as follows. Actually, before I tell you what he decided, what would you say? Can you go ahead and kill one in order to save the other?
What?
Doctor? Yeah.
Does one have a higher survival rate than the other?
Higher what rate?
Survival rate.
That's a good question. That will play itself out. Let's say the heart seems to be more. We don't know about survival rate, but there's one key point that Aviel is asking or alluding to, and that is that the heart was more positioned in the chest of one over the other. Any other thoughts?
Well, I think if the heart is more positioned in one person, that kind of changes things a little bit, because it makes, at least from my understanding, it makes it seem like it's more like their heart almost. It's kind of hard to draw a division when the two people are fused together. But I think the situation is pretty tough already, because it's different from the situations you described, because you actually have to actively, you're not withholding water, you're actually actively killing, So, but I do think like it kind of depends where you're kind of drawing the line. Like if what you're saying is that the heart seems to be more like one person's heart, and then the other person is kind of like living off them, then I think it's a different situation. It would probably be okay to kind of end the life of that other person attached, because otherwise they're both gonna die, and it's kind of like that other person is keeping them alive. But so it's tricky.
Tal's making very good points, and that's exactly right. That is very tricky. And if you want to compare it to our classic example that we talk about with, Kiton Echad Shamayim, having one flask of water, it's a little different, because it's not as if I have the heart, twin A has the heart, and he has to give it or not give it to twin B. They're sharing it. They're both holding on to it. I have a better grasp. I could pull it away from twin B. But like Tal said, by doing that, I'm actually actively killing twin B. And in general, you're never allowed to actively kill. You're allowed to hold it for yourself. Let's say there is one flask of water, right? And there are two people in the desert walking. And I see the flask, and my partner sees the flask, and we're both so thirsty. And we see that flask. Am I allowed to bolt for it and try and get it for myself? Yes, you are. But are you allowed to, let's say, am I allowed to take a knife or a gun and shoot the other guy so he doesn't get that flask? You're not allowed to do that. You cannot go ahead and kill the other person who's walking with you so he doesn't get the flask or steal it from you or beat you up. That you can't do. You can't do that in order to survive, to save yourself. You can never actively kill. So if it's my heart, if it's twin A's heart, so then I don't have to give it away. But if it's shared, or if I have to actively kill twin B in order to keep the heart, it's hard to make that analogy, and we're stuck. But Ramosha came out with a brilliant analogy to something else. Anybody ever hear of the concept of a pursuer? A rodef? The Talmud tells us that if you see someone, let's say John is chasing Jack to kill Jack, and he's got a gun and he wants to kill him, and he wants to kill him. If you can stop John from killing Jack by tripping him, catching him, calling the police, you must. Let's say there's no way to stop John from murdering Jack. The only way you can stop John is by killing John. Are you allowed to kill John? Normally we cannot murder. But if you see someone who is pursuing Jack to kill him, you're allowed to. And similarly, if somebody is pursuing a woman, a married woman specifically, and trying to commit adultery, you're also allowed to terminate the perpetrator to prevent that woman from being violated. Two unusual cases, but in our case, the relevant story is murder. If John is trying to kill Jack and there's no way to stop him without killing John, one is allowed to kill John in order to stop Jack. It's a concept of rodef, that if somebody is a rodef, he has foregone his right to life, he no longer carries the same noble rights to life that all human beings are given. And therefore, since he's foregone that, there's permissibility to take the law into your hands, so to speak, and terminate his life. That being the case, Ramosha said that in this case, and this comes up in abortion cases too. If the child in the mother is threatening the life of the mother, the unborn fetus is threatening the life of the mother, there's a whole question whether abortion is permissible because it's not a full life form or it is a full life form. But even if it is a full life form, and even if you want to give it a status of life of the fetus, if it's threatening the life of the mother, halacha, unlike Christian doctrine, in Jewish law, it's agreed by all that if the mother's life is being threatened by the baby, even if it's close to term, even if it's well developed, then one is allowed to abort the fetus and terminate the pregnancy in order to save the life of the mother. And actually, an interesting other question that comes up in cases is what happens when the mother says, no, I'd rather die and let my child live. Is one allowed to do that? Not so simple, but the mother wants it and they discuss it. If she has, if they're equal, if not one or the other, if they're equally, like during the actual delivery, when God forbid it's a terrible thing when it happens, but it can be where it's either you save the mother or save the baby, they each have equal kind of status, then you're not necessarily allowed to terminate, and then it's a complicated decision what to do, for a different talk perhaps. But before that stage, when the baby inside the mother is, for whatever reason, threatening the life of the mother, one's allowed, because the baby is a rodef. The baby is a rodef to the mother. The baby is pursuing the mother and threatening her life, and it's as if John, the baby is like a John, chasing the mother to kill her. Similarly, Ramosha looked at the situation and looked at the medical data, and he saw a twin B who does not have the heart in his chest, but is siphoning off life and energy and long-term survival, threatening twin A survival, threatening the survival of twin A. So twin B was deemed as a rodef, as a pursuer of twin A, and therefore it was felt permissible to be able to terminate and do the surgery and cut out twin B in order for twin A to survive. And twin A and the surgery was long, and they actually went ahead and they gave twin A the heart, and it was a fascinating 5-chambered heart. The baby lived for a while. The baby ended up, unfortunately, not living long term because of other complications. But that was the decision, and the decision was based on this concept that since twin B is rodef for pursuing twin A, then it is permissible to terminate and end the life of twin B, even though the act of surgery will kill the baby in order to allow the survival of twin A. Any questions, thoughts?
Dr. Roth?
Yeah.
I just had a question. Were they born at the same time? Was it a C-section, or did one head come out before the other?
So most of these are C-sections. I don't know the answer to that. It's a good question. I don't know that it would matter, because you can't cut out, one that's born first at the time doesn't have a right more than the one that's born second. It's more that while you're judging the situation, then you look at who is threatening the life of the other, who's the one who's the rodef, and who's the one who has the life, so to speak. But it's an interesting thought that if one came, let me think about it, if one came out first, so then they're alive, but once the other one's born, theoretically what you could say is that if there would be such a theoretical, it's not really practical or realistic, but if one was born and they're fully alive, and you want to say that the other one still has a status of a fetus and is not really a nefesh, and it's a whole dispute between the Rambam and Tosfos and other authorities whether the fetus before birth has a status of a nefesh or not really a nefesh, and it has reduced rights to life compared to fully fledged born babies, that itself is a question. But if that were the case, then you could argue that at that moment, right there, after the first baby's born, you can sever off the other one, but it's just not realistic. But if that's where you're going, that would be the only relevant case.
I had a quick question. When it comes to the Siamese twins, does there any mention about like if the rules change, if it's like monozygotic or dizygotic when they're originally starting their development?
Right. So it wouldn't matter because again, once they're born, they have life status equally, whether they're one form or the other. I think if I recall, Siamese twins are always monozygotic. I'm pretty sure.
All right, thank you.
I see a question here from Amanda about the airplane. Put your mask on before helping others. The truth, I guess the question is, if you're in a situation, I don't know, about masking or let's say oxygen, a plane's about to crash, right? And you put on you put your oxygen mask on first, or do you help someone else first? Let's say the other person next to you is a cardiac patient and they really need their mask badly. Well, I guess if he's going to die because he needs that oxygen right away, the pressure in the cabin is dropping, the oxygen content is dropping, and he's gasping for oxygen, and you can do fine for an extra few minutes and save Mr. Goldberg next to you, who has a cardiac condition and he's gasping for air. Then yes, the requirement would be you both survive. You should save Mr. Goldberg by putting on his oxygen first, and then get yours, even though you'll be like really in trouble or out of breath, but you'll make it. If there's a chance that you'll die by giving up that time to save Mr. Goldberg, then you're not required. You put on your own oxygen mask and put on Mr. Goldberg's. The flight attendants always tell, the instruction always put on your mask first and then help others, because you'll be much more equipped to help your child, your father, whoever it is, once you have oxygen. Because you can think you're being a hero, and in the midst of being a hero, if you pass out and then you can't help Mr. Goldberg or your child, God forbid, then that doesn't accomplish much for anybody. But yeah, the same thing would be true in Jewish law. You're required to save yourself first, and then obviously there's a requirement to save others. Does anybody know, how do we know there's a requirement to save another person? If I'm walking down the street, I'm on my way out to dinner with my wife, we're really excited, we have reservations to a great show, and I see somebody fainting on the side. Do I have a requirement to save him? Who says I have to? Do I have to? I have plans. It's not in my schedule. This is really inconvenient. I'm going to miss the show. I'm going to miss the dinner appointment. I'm going to miss the party. Do I have to go and save the other guy? Well, who says I have to go and do anything?
The pasuk in the Torah.
Say again?
The pasuk in the Torah.
Right. The pasuk in the Torah is exactly correct. It's pretty explicit. Anybody remember it or know it? Excellent. Wow. I'm impressed. Do not stand idly by your friend's blood. That means that if somebody is in a life-threatening situation, you are required. Not just it's a nice deed, wow, give you a hero, award. It is a heroic thing. It is a wonderful thing to do, but you're required in Jewish law to do it. I have a friend of mine. He's not Jewish. He trained with me, and we did our fellowship together in Ratna. So he was a kind of a jolly, gracious, kind of didn't really worry too much about other people's thinking. He would wear his sandals in the hospital. But he was a really good doctor and really, really caring. When he was a resident, there was this big meeting. There's a big ophthalmology meeting every year in Florida. And now it's in different cities, but at that time it was always in Fort Lauderdale. So one day they're driving on I-95 in Florida, and there's a big traffic backup, and their ambulance up front. So he's an ophthalmologist. He's not a physician, and I mean he's a physician. He's not an ICU guy. He's not a critical care doctor. He's an ophthalmologist and a good one. But he went, he's a medical doctor. He gets out of the car, he goes to check it out. He does not have a license in Florida, by the way. He's not licensed to practice medicine in Florida. He goes over there and sees what's going on. He sees the paramedics. They're having a hard time intubating the patient. They just can't get the tube down the throat in order to connect them to oxygen and put them on a machine to breathe. And if you do that, you can really lose a patient by not getting him intubated. And he says, excuse me, let me take a look. I'm a doctor, and he just makes his way through, says, let me try. He takes the it's called the device that the laryngoscope that holds the tongue out of the place and allows the throat to be open, looks inside, takes the tube, passes it through the trachea, through the vocal cords in the trachea, hooks him up, says, should be good now. And he takes off. He didn't want to, who are you? What? He didn't give his name. He didn't want to get into trouble. He's not licensed to practice medicine, but he saved the guy's life. Now, sometimes you have to weigh out, are you allowed or are you required? For sure, he did the right thing, but are you required to do that? If, let's say, something went wrong, he would lose his license. He'd be in big trouble. I don't know if they would prosecute him because he tried to save someone's life, but if he was an ophthalmologist, not a critical care doc, who's not licensed in the state of Florida to practice medicine, and he goes ahead and he starts to do something and he, let's say, put it in the wrong place or something happened and the guy had to bleed and he died, he could have been sued terribly. He could lose his license. He could have been sued a lot of money. So it was a quote unquote risky thing to do professionally. And the big question is, are you required to do that? What do you guys think? You feel you could save him, but there are risks.
I think it depends how qualified you are. Like if you are if you've done many intubations and you have the skills to be able to do that, then I think that you should be. But if you don't have those skills, you shouldn't try and do something that you can't do, because that would put a higher risk.
I think that's a good answer. Let me change the question a little bit. Let's say you can save his life, but you know that if you get caught, you'll go to jail. I'll give you another example. Let's say there's somebody who has a do not resuscitate order on his chart in the hospital. He does not want to be resuscitated. He said, I'm 75. I've seen my wife go, through terrible pain and suffering through being intubated. I do not want that. I refuse to be intubated. You're the doctor in the hospital. This guy comes in with pneumonia. He's sick as a dog. He cannot breathe. It says, do not intubate. He's even lucid for now. And he says, I don't want to be intubated no matter what. And you tell him, or let's say he's not lucid. And you know that if you intubate him, it may be a day, 3 days a week, but if you treat his pneumonia and his lungs clear fluid, he's not dying per se. You can turn him around. He can have years of life. It's just a matter of treating this pneumonia and getting him through it. He said, no, I don't want to be intubated. Are you allowed, or are you required to go and violate his living will? That if he may survive and he could still sue you for saving his life, or he may die and the family can sue you for the pain and suffering you caused him, and you can lose your license for violating the do not intubate in his record. Are you required in that? And you're graded. You are the best intubator and ICU doctor in the state. They call you when it's a tough intubation. You're fully competent. But the order says do not intubate. And this guy is just a matter of giving him some high-dose antibiotics and getting him through the course. Am I required to do it?
Doctor?
Yeah.
I don't think you're required to put so much of your life at risk, or quality of life at risk, in order to save someone that doesn't want to be saved.
Okay. That's a good point. So how much is it? So as I mentioned to you before, the Talmud tells us that for a mitzvah, a positive commandment, you have to give up a lot of money. You have to spend, if it's a required positive mitzvah, let's say to eat matzah on Pesach, and there's no other way to get it. Fortunately, today that never happens. There's always a way to get matzah, and it's not that expensive, even though hand matzahs can be pretty expensive. You have to give up to a fifth of your assets. If you're a poor student, it may only be, a little bit of money. If you're, more wealthy, it could be a lot of money. But to give up to a fifth of your assets to do a mitzvah, a positive mitzvah, to not violate a violation or a negative mitzvah, to not violate it, you have to give up all of your financial assets, all your money. It could be a lot of money. If you're a rich man, it's a lot of money. In order not to violate, let's say you're somewhere, and the only way to eat kosher food is to spend a tremendous amount of money. There's no other way to get kosher food, and otherwise you're going to starve. Well, you can always eat vegetables, so it's never an issue. But theoretically, if the only way to survive, to get kosher food, and otherwise you want to eat non-kosher food, you can. It's never an issue of money. You have to spend lots of money. We spend lots of money for kosher food all the time. But even a lot to avoid a violation of a negative commandment in the Torah. What about going to jail? Where does that fit in? So like Aviel said, it's not, I don't know if I call it quality of life, because that's kind of a term that has a lot of connotations in medical ethics. But the point is that going to jail, this was a ruling by some contemporary poskim, going to jail or potentially going to jail is like more than all your money. It's yoiser mikol mamoinai. It's more than all your assets because it's a pain and suffering. Who would not give up all their assets to avoid being in jail? No, pretty much anybody would, and it's considered more than all of his money, and therefore that would be considered more than required, and you would not have to follow that order. There's also an opinion that says that for not standing idly in front of your friend's blood, or lo samad al dam recha, lo tamad al dam recha, that would be a passive violation. Some say that to not violate a passive negative commandment, that means if I go ahead and I actively do a violation and I can spend money to not do it, right? Somebody says, either, eat this non-kosher food that's totally non-kosher, pork, whatever it is, or I'm going to take all your money. You have to say, take the money, not going to eat it. But let's say they say, let's say it's something where by giving up your money, it's not doing something, just standing idly, not doing anything, being passive. Maybe you don't have to give all that money in order to just be passive instead of being active. So there's a dispute about that, whether that's considered you have to give up to a fifth, like a positive commandment, because it's about not doing something, versus you have to give up all your money. But the point is that going to jail or being prosecuted for it is considered more than what you'd have to do. So that's a good point there. Any other questions?
Dr. Roth,
Yes.
it's Sue. Got a
Yes.
question. Okay, you brought up halacha and you brought up living wills. There are halachic living wills that are able to be filled out. Does a doctor have the right to change that halacha, even though you have it set up for a rabbi who is going to be making sure that that patient's halachic beliefs and wants is followed?
So a doctor is never allowed to change a patient's living will. The living will has to be followed. Ideally, if someone follows a halachic living will, which is the right way to do it, under the direction of a rabbi who knows these laws, then the medical team has to follow it. And even if there's a doctor I know who runs, Dr. Lebowitz, who runs a acute care facility, a long-term acute care facility, and there are patients who are at life-threatening risk all the time. And one patient, the family will come in and says, we want to do everything and anything, so go full court press. And he'll do it. And for somebody else, same disease, he'll say, no, we don't want to, we'll intubate him, but we won't want to resuscitate him or more. And he'll follow it, because if they have a living will, that's what they follow. And especially if it's a halakhic living will, even if one has a rabbi who he relies on who goes with a more aggressive approach and the other goes with a more lenient approach, it could be their features of the patient that led to different determination of the living will. It could be their features of their rabbi's view of the halacha that is subject to a little bit of a different approach, and that's okay. And the doctor is okay following that, as it may be uncomfortably ethically if you have a certain belief system that you have become accustomed to yourself in your own knowledge of halacha. But as a physician, if there's someone has their rabbi, they have their ruling, it's not some outlandish rabbi doesn't know what he's talking about. It's someone who has studied it and understands it and knows the parameters and has given the patient the directive based on their living will, or with the halachic living will. And it's incumbent upon the doctor to follow that halachic living will, because that's the patient's, that's what he's following. That's his directive. Listen, I want to thank everybody for your interest. Great questions, great ideas. Sometimes medical, ethical, halachic decisions can be complex. They can be challenging. You know, the beauty is if you have the right people who know all, you know, law, even in secular law, is often based on precedent. You find precedent. In Jewish law, there's always precedent. It's not about whether there was a car at the time of the Talmud to know whether you could drive on Shabbos. It's about look at the mechanics, look at the mechanism, break it down, understand it. Everything in life can be broken down to its components and understand what is it, sometimes a matter of understanding what is it most similar to. Is it a concept of, you know, with Shabbos laws, these modern technology issues, it's an understanding what does it have to do with medical legal decisions, same thing. It's a matter of understanding all of Talmud and all of Halacha and all of Shulchan Aruch, and being able to understand what the precedent and what the rulings are and how they would apply to more modern technology and more modern situations, whether it's in medicine or elsewhere, and apply it properly. I submit to all of you to take on your future. I mean, I guess many of you are, if not all of you, are interested in the healthcare sciences and the profession of healing. And in so doing, it's a noble thing to do. It's not just another job. It's an opportunity to be there, to care for others on a daily, regular basis, to be seen as a voice of counsel and insight, to be able to really change and transform people's lives for the better in whichever way you can. Sometimes realize our own humility that there's so much we cannot do, but also realizing that, you know, people trust us, and we should always be cognizant of the trust that they put in us, and never violate that trust, whether it's by being callous, by saying things that are not kind, or by not listening to where they are and who they are. And realizing that, you know, it's not just another title. I always found it fascinating. Why am I Dr. Roth, whether I'm in shul or in work or in school? Like, what happened? Why does it, you're not lawyer Smith and plumber Jones, but I'm always Dr. Roth because it's a defining feature. Medical training is very much a defining part of a person's training in life, but also that professional obligation and responsibility is also a very defining feature of who you are. So I submit to all of you to take that charge with humility and with kind of a sense of opportunity, and I'm sure you'll all be successful. I look forward to hopefully interacting with you again in the future. Thank you.